What's wrong with this picture? I'm wearing a mask, but is it really helping me or helping anybody else? Welcome to Getting Understanding with Dr. Darrell Ellis. I'm Dr. Darrell Ellis, your host for this YouTube channel, and wanted to continue along the lines of some of our previous videos and start making a little bit of a transition into a broader scope of topics. We've talked already about COVID-19. We've talked about vaccinations and how important those vaccinations are. We've talked about some of the things that we need to consider now that a larger and larger portion of our population is getting vaccinated. What needs to happen? What is life going to be like moving forward? Is it going to go back to what it used to be like, where we kind of went where we wanted to go, did what we wanted to do, and didn't really have much regard or much care about this whole vaccine process? The pandemic is over. We can go back to being the way that we were before it ever struck. Well, I may have mentioned some of these things in prior videos, but I wanted just to kind of stress a few things moving forward. Unfortunately, we're a long way from being at a point where the pandemic is completely over. In part, that's as a result of the fact that we're a long way from a majority of the population, both in this country as well as in the world, of having received full vaccination and protection against getting sick. As a result of that, the virus is continuing to circulate throughout the community. And as long as it sticks around, the longer it sticks around, the greater the risk is for it to mutate and become resistant to some of both the preventative measures we have, as well as some of the treatment modalities that have been developed to be able to combat it in patients who do become ill. So what do we need to be doing? Well, I started out by showing you what I look like with my mask on improperly. And the question is, what's wrong with that picture? I'm going to put it back on for you, and I'm going to put it on in a way that's the wrong way to put it on, as well as wear it in a way that's the wrong way to wear it, so that you can see the difference. I'll go back and do it the right way. So what I hope you saw when I put the mask on is that I touched the front of the mask in the process of putting it on. I've now, if I've been around anyone who's been ill, whether it's with COVID-19 or with any other illness, viral illness or bacterial illness that's airborne, I have now exposed my hands to the part of the mask that is filtering out those particles. I've now contaminated my hands. In addition, as you see that I have the mask on, and I see a lot of this when I'm out in the community, particularly in supermarkets and places like that, people walking with their mask below the level of their nose, because for their personal preference, that makes it easier for them to breathe. Unfortunately, that actually eliminates any protection that they're receiving by having a mask on, and even more importantly, eliminating any protection that they're providing other people that they're around, should they be carriers for a viral infection. Why is it important to talk about that? Well, because once again, wearing a mask is more for the protection of people around you than it is for your own protection. Now let's go through how this should properly be applied. First of all, you should never touch the front of the mask. These elastic straps, and in the case of cloth masks, the cloth straps, are what you should be touching when you manipulate or either take on or take off the mask. You go ahead and stretch the mask open, apply it to your mouth and your nose, and then apply it behind your ears. You can then adjust the mask by reaching underneath it and pulling it down, or reaching inside the sides and pulling it up to adjust it, never touching the front of the mask. While you're wearing the mask, you should have both your nose and your mouth covered at all times when you're in an indoor environment and within 6 feet distance of other people. Now, if you are outdoors, the CDC has now stated that mask wearing is not necessary. But in indoor environments where you cannot guarantee appropriate social distancing of 6 feet or more, you should have your mask on, apply it properly, and apply it safely. Now, having done that, the other thing that's important that I did not mention in my previous video is continued hand washing and hand sanitization. It's very important. Because as I illustrated in the improper use of the mask and improper application of the mask, we are often putting our hands in a position where we can be picking up droplets that can be infected, whether we're realizing it or not. Whether it's from putting on your mask the wrong way or sitting down at a table and putting your hands on the table. You have no idea who's at that table before you were. Nor do you have any idea whether or not the people who work there or who are in that place know the proper way to sanitize the table between the previous customer and yourself. And then you come and you put your hands on the table. If you're going to restaurants at this point, you're picking up menus. Once again, you have no idea how well that's been sanitized. So it's very important when you're going into or going out of a place that's outside of your own domain, where you're around other people or around places where other people have been, that you practice frequent hand washing and frequent hand sanitization. When I go into a place, I sanitize. When I come out of a place, I sanitize. When I'm in an area where I can wash my hands, I wash my hands several times during the day to try and make sure that this part of my body is as clean and sanitized as possible, because it's very easy, whether as a result of habit or as a result of circumstance, to put those hands in your face. Whether it's as a result of you may sneeze and put your fingers to your nose, your eye may itch, you start rubbing your eyes. You may have allergy problems and you have your hands in your face all the time. You may be one of those people, like myself unfortunately, who has the bad habit of chewing their fingers. I've had to work really hard on keeping my fingers out of my mouth during the course of this pandemic. Not everybody has been as conscious of it. So you've got to keep those hands sanitized for your own protection. And once again, for the protection of other people. Because you're going to come in contact with other people with those same hands. If you're handling money and you're handing that money over to someone else, like a cashier at a grocery store, a department store, using your credit cards, if you're allowing other people to use your cell phone, these are devices and these are items that you're touching with those very same hands that, if not sanitized, you can be passing on something that you picked up from a person before you onto the person behind you. So hand sanitization is very important. And then lastly, and I kind of touched on it, keep your hands out of your face, because that's the portal through which things that are on your hands can get into your body, your nose, your mouth, and your eyes. So try and keep your hands out of your face if you can. If not, be sure that you're sanitizing very frequently and performing frequent hand washing. I look forward to the conversation moving forward. Welcome to the YouTube channel. If the content here is something that's appealing to you, if you find yourself wanting to know more, just click here. You can see some of the other videos that we've already recorded, and it'll give you access to videos in the future. Also, take this opportunity to click like and subscribe so that we can keep track of how many people are watching us, and at the same time, it'll give us access to questions that you may have. You'll be able to post it on the channel, and I'll be able to address those topics in future videos. Thank you again.